Can you see my slide?
Yes.
Oh, good. So today I'm talking about a very unusual case, a secondary bilateral filtering bleb in a patient with Marfan syndrome and a very complicated history of eye surgeries. So this is a 59-year-old female Caucasian lady has the history of Marfan syndrome with lens subluxation. So in 1995, she has a bilateral cataract extraction and suture IOL by Dr. Milverton. In 2004, her right eye presented with a sublux IOL after she rubbed her eye. So Dr. Mackay performed a iris clip lens to fix that condition. In 2013, her right eye developed bullous keratopathy and corneal endothelium decompensation because of the contact between the lens and the back of the cornea. So Dr. Mellis did the IOL exchange. And in 2015, unfortunately, her right eye had retinal detachment. So Dr. Thanh did the vitrectomy. And in 2018, the right eye filtering bleb was first noted. And in 2019, the patient will refer to Dr. Clement for further care. On examination, her vision was 636 in the right eye and 66 in the left eye. The pressure was 5 in the right and 9 in the left. In the right eye, we could see an overhanging filtering bleb with CDL positive. So there was a leak on this filtering bleb. And in the left eye, she also developed a whole overhanging filtering bleb, but there was no leak. The cornea in the right eye looked hazy with some descemet fold and the endothelium decompensation. And the left eye cornea was clear. The anterior chamber were deep and quiet, and she had bilateral suture IOL. And the posterior segment examination demonstrated a central subretinal fluid and flat retinal around and no glaucoma optic neuropathy in the right eye, and a flat retina and no glaucoma optic neuropathy in the left eye. This is the pictures of the anterior segment. In the right eye, we can see a filtering bleb with some leaking here. And this is a normal picture. And this is the left eye, another filtering bleb, but no leaking. This is the macular OCT with some central subretinal fluid in the right eye and normal macula in the left eye. And she has the normal INFL thickness. So the diagnosis here is both eye filtering bleb, but right eye, the filtering bleb could be secondary to vitrectomy or secondary to the suture IOL. And the left eye is a filtering bleb secondary to the suture IOL. And the treatment plan is because she had some leaking of the bleb. So Dr. Clement and I will perform a bleb revision and scleropatchgraph next Tuesday, and we observe the left eye. Marfan syndrome is a hereditary connective tissue disorder characterized by the musculoskeletal, cardiovascular, and ocular problems. And the condition caused by the FBN1 mutation on chromosome 15. This encoding fibrin 1 and this cause accounted for 80%. And about 20% was the inactivation of mutation in TGFB receptor 2. And the pattern is the autosomal dominant with high penetrance. And about 25 to 30% of cases are sporadic. FBN1 is the main component of the extracellular microfibrils in many tissues, and this provides stretch and elasticity to connective tissue. Fibrillin is a glycoprotein and also a major structural component of the microvirils surrounding the elastin core in the extracellular matrix of the sclera, and this maintains the rigidity, strength, and elasticity of the scleral tissue. And the mutation of this gene cause the disorder and decrease incorporation of fibrillin into connective tissue matrix. And there are some ocular structures which are rich in fibrillin, including cornea, zonules, lens capsule, and sclera. So the mechanical stretching of the sclera containing abnormal fibrillin molecule might lead to axial length elongation and scleral thinning, and this poses a high risk in perforation and leaking from scleral wound dehiscence. So spontaneous or primary filtering bleb have been reported in a variety of conditions, including penetrating trauma, Axenfeld microspherophakia, Marfan Wiener syndrome, triple C syndrome, scleritis, high myopia, Turin, macular degeneration, and some systemic problem like craniofacial dysmorphism. But the secondary filtering bleb is quite rare, and the first case reported was a filtering bleb at the site of suture posterior chamber intraocular lens. In 2 cases, and this case was published in Journal of Cataract and Refractive Surgery in 2003. The only post-vitrectomy filtering bleb case I could see was published last year, but this case was reported in the triple C syndrome, a quite rare entity. And the lesson learned from this case is for any intraocular lens surgery plan for the patient with abnormal connective tissue, we should make a very good plan, and we should avoid the site of the filtering bleb if it happens there, and we should be very careful when creating the pockets for a scleral fixated IOL. And the other options, we can use iris claw IOL or suture fixation of 3-piece lens into the iris. And here are some references I use for my talk. And thank you for listening.